London, 8 a.m. For most residents of the capital, it's set to be just another day. But at the Cromwell Hospital, a world-leading surgical team is gearing up for a life-or-death operation where their patient has just a 50-50 chance of survival. The future of a young man is in their hands, and they have only 24 hours to give him back his life.
Agora grande vai ficar Erick dor. Vai abrir. Vai guardar dos tricos que eles seguiram. Já diria minha comida me salvo. Daí eu vou dar. Por isso que eu quero guardar minha comida. Daí eu vou guardar essa coisa.
Erick's tumor is so rare, it affects only 1 in a million people and is the weight of a second head on his body. It's now slowly suffocating and starving him to death. Life in Uganda is tough. Erick's father is a farmer who struggles to make a living. The family lives deep in Uganda's backcountry, 50 miles from the nearest hospital. As a result, for most of his childhood, he has struggled to live with the growing tumor without any help. But things changed when church missionaries discovered him on a visit to his village.
He lost his mother when he was still young, so his father tried to take care of him, but they really had nothing much. He really never had much hope for living longer.
One of the missionaries, Brian Kazozi, witnessed firsthand the daily stigma that Erick endures.
Everyone around him was saying that there is no medication. They first thought that he was bewitched. Whenever he went to school, like, children could laugh at him, and he really lost all the confidence. He felt like he was an outcast.
Brian decided something had to be done and found a charity, Facing the World, a team of British surgeons who agreed to take on Erick's case. Erick's father speaks no English, so he signed guardianship over to Brian, who has put his life and career as a successful artist on hold to bring Erick to the UK.
It's now like a brother to me. It's part of my family.
By the time Erick reached London, he was on the brink of death.
This is a boy that couldn't really swallow, he couldn't eat. He slept with his finger in the corner of his mouth propped up at an angle to allow air to get into his lungs. But that can't continue for very long because his tumour was increasing in size.
On his way to the airport in Uganda, Erick had several serious health scares, and these were so serious that everyone thought he was going to asphyxiate and die because he couldn't breathe. And so the first thing that we had to do when we got him here to the UK was to fit a breathing tube so that he could breathe safely. I'm hoping that we can kind of get underneath it, flip it up.
This operation is a first for 2 of the UK's top plastic surgeons, Simon Eccles and Niall Kirkpatrick. Together with their team, they are going to try to remove the tumour and reconstruct Erick's face. But he's already so weak that there's a 50% chance he'll die on the operating table.
He gave me his message for his family to pass it on, just in case he doesn't recover.
It's very difficult when actually you know that they're saying goodbye to their loved ones before they go to sleep and they may never wake up again to see them.
Okay. Pop this arm down for a second.
The tumour has invaded most of the right side of Erick's face. In ideal circumstances, they would remove it and reconstruct his face over a series of procedures. But with Erick barely fit for one operation, multiple anaesthesia poses a significant risk to his life. So the team has decided to do the removal and reconstruction at the same time. It's a complex, time-consuming operation. The team has a maximum of 24 hours in theatre. Erick won't survive any longer.
Of course, things can go wrong. You know, there can always be terrible things that happen, and they do, and it is dreadful when they happen, but the more planning that you do, the better.
The plan is to split the operation into 3 stages. First, seal off the blood vessels in the neck, then remove the tumour in 3 parts, and finally reconstruct Erick's face.
Just really stand up.
With the press of a button, the countdown begins.
Screw, please.
These first minutes are all about preparation. State-of-the-art CT mapping equipment is screwed to Erick's skull.
That seems to be rigid.
It builds a precise 3D image of his head. They will use this as a reference later in the operation when they rebuild it. 40 minutes in, with all the prep completed, they make the first incision.
Mr. Grant's just exposing the carotid artery. That has the main blood supply to the brain. There's lots of bleeding. We know by temporarily blocking it off, that'll reduce the blood flow.
It's delicate and precise work.
Is that too small? Slightly bigger.
One wrong move and the operation will be over before it's begun.
And is the colour okay, Will?
Other way.
We knew that if there's a problem with blood loss, we weren't able to deal with it, that would be catastrophic, and that would be the end of Erick. We would not be able to save him.
We could get very severe bleeding, and that's the most dangerous time during an operation, when a patient can die.
Big artery clip, please.
Just 42 minutes in, and the team's worst fears start to materialise as Erick runs into problems.
Actually, you can see it right now below you, Will. Right. Just a bit of bleeding from the internal jugular at the moment.
46 minutes in, time is crucial. With each passing second, Erick is losing more and more blood.
During a surgery procedure where everything you're trying to do is very, very controlled, when something adverse happens and you're putting your hands and pressing, but blood is welling up from through your fingers, it's a very frightening thing.
With each passing minute, Erick is inching closer to fatal blood loss. 48 minutes, Erick is in trouble. The team must seal off the puncture before he bleeds to death. A team of some of the UK's top plastic surgeons are 1 hour into a 24-hour operation to remove a potentially fatal tumour.
Do you want me to retract there, Will?
Yeah.
Their patient, 17-year-old Erick, was rescued from a life of poverty in Uganda. For 14 years, the massive tumour has starved him of vital nutrients. As a result, he is seriously malnourished and is so weak that the surgery could kill him. And already he has a bleed that surgeons are struggling to stem.
Will, was that internal jugular or carotid?
Internal jugular.
Erick's very small for his age, and as a consequence, there's much less blood flowing through his circulation. It doesn't take very much blood loss to be life-threatening for him.
They must keep calm and try to tie off the leak to prevent Erick bleeding to death.
If you start to rush and cut corners, it causes more problems, and that's a fatal thing to do.
With the final stitch, Erick stabilises.
Thanks, Will.
Go for a lie down now. So we've now isolated the blood vessels in the neck, and actually it was really quite difficult. Even a small bleed like that, his heart rate went up and his blood pressure dropped, so we know they've got to be very, very careful.
Having had a stark reminder of the risks of this operation, the team moves cautiously onto the next stage. They must first expose the tumour before they can begin to remove it.
The plan's to approach the tumour from the brain side so that we can make a hole in the skull from above, and then we can push the tumour down into the face, and that way we'll be able to see it much more clearly at its edges.
Small swab, please.
2 hours in, and the intricate work of exposing Erick's skull begins.
And let's have some cat's paws, please.
Erick has had this tumour for 14 years. The bigger it's grown, the more impossible it's made his life.
It stops you breathing, it stops you eating, it stops your normal growth and development. But more than that, it stops all those things we take for granted. That's being able to go and speak to a friend, it's being able to make relationships, it's being able to go to school and have an education.
He had started school when he was 3 years, but in the same year is when he got the disease. He had started going to learn how to read and write, but he couldn't feel comfortable there because all the kids were staring at him and laughing at him, so he decided to drop out of school.
If he survives the operation, Erick is determined to return to his education. Erick and Brian are now like brothers.
Erick has many dreams. He told me he wants to be a music artist. Then some other time he told me he wants to be a football player. And many things keep on coming to his imagination.
Baby, oh no, baby.
You're moving together.
While the surgical team works on Erick, Brian waits, wondering if he'll see his adopted brother alive again. Over 4 hours in, they have exposed the tumour and can start preparing for its removal.
We can see the top of it here, we can see the bottom of it down here, the side of it here, and this goes round the side here.
The tumour has invaded Erick's brain cavity, right cheek, and even taken over part of his jawbone.
Can we weigh that, please? And then it needs to go in formalin.
So it must be removed in stages to avoid damaging any undiseased parts of his head.
This is the base of the mouth area before, where it was all getting a bit stuffy and horrible. This is the area that was on the front of his face. This is another section of the tumour, and you can see this is the right upper jawbone section. You can see the teeth that were part of the right upper jawbone there.
The combined weight of the tumour parts is 2.5 kilograms, almost the same weight as Erick's head.
When we measured it, roughly it was about 16 by 17 centimetres in size, which is not dissimilar from the size of a football.
The team is 9 hours into an operation with a 24-hour time limit. With the tumour removed, the next stage is to start reconstructing Erick's face.
We don't know what he would actually have looked like, and so what we have to do is put pieces back into place that are his, into what would be the most normal positions that you can find. So I'm sure it's close, but of course, if he'd never had a tumour and grown up without any problems, he wouldn't have had a face quite like this, obviously.
Hour by hour, Erick's new face is taking shape, as piece by piece the surgical team reassembles it.
We've put the bit of bone that forms the tops of the eye sockets back on, and we've put the forehead back on, and now the nasal bones We are attaching with a plate back onto this so that we're rebuilding the skeleton of the nose and the face. You finished nose?
Yeah, ready back. And I'll take another emergency screw, please.
Another 5 emergency, please.
Just over 12 hours in, they have made good progress with the reconstruction. But as time goes by, Raj, the anaesthetist, is becoming increasingly concerned about Erick's vital signs.
His blood pressure's dropping, his heart rate is very, very erratic. Raj really wants to stop the operation. And sometimes we just don't know why this happens.
Get them closed quickly, and then we can tidy things up later if we have to.
Yeah.
We knew there was a significant risk Erick could have died at any point in the procedure.
But this is the moment where somebody is saying, he's in big trouble, get on with it, and you have to. We are nearly done, Raj.
The original plan was to do the entire procedure within 24 hours. But now the surgical team are going to have to abandon that plan. With only half the work done, the risk to Erick's life is too great. With Erick's blood pressure so low, the team has no choice but to abort the rest of his reconstruction and races to get him off the operating table.
Very quickly, the heart can be pumping normally, and the next minute, it's not. And it doesn't take very long before your brain isn't getting enough blood and you can die.
Clip, please.
Clip, please.
Clip.
Archer clip. Throat pack is out. Can somebody mark that?
The pressure is really on, and every second can count. But when a patient's starting to lose control, then they can arrest at any moment.
Quickly, please. We need all things quickly.
2O silk suture, please. Scissors. Scissors.
If Erick is kept under anaesthetic for much longer, he could go into cardiac arrest.
I don't think now's the time to be fiddling around. Bit of dressing we're done.
Raj, how is he?
A bit more stable. Just had a bit of a loss as to why it's happened, to be honest.
Erick's heart is stabilising, but his face is only half built. He'll need another risky surgery to complete the reconstruction.
Yeah.
Thanks very much, everybody, for staying. I really, really appreciate it. Thank you very much. Thank you.
These are the risks of long anaesthesia and complicated surgery, and
People are not fit to start off with, really.
that's why you must spend the next few days on the intensive care unit being looked after.
It's 4 days since a 2.5 kilogram tumour was removed from Erick's head. His recovery has been slow, but at last he's fit enough to be moved out of intensive care.
Hi there, how are you?
Come here.
Hi, Erick.
Erick, sit down. Doctor has come to say hello to you.
He's a tired boy.
You've been sleeping.
Hi, Erick.
You see, you can open your eyes and see him now.
How are you? Are you okay? Good to see you.
Well, you want to express your feeling to your doctor.
know.
That's not bad. That's
I
all
know.
right. That's okay. That's okay. All right?
I'm sorry it's so frustrating for you. I'm sorry that you can't understand what I'm saying, but I hope you know we're trying to help you. Well, I think, there's a psychological element to surgery, but also there's huge physical effects. 12 hours of being anaesthetised and longer, all those drugs and medications running through your system. You feel slightly confused. You can't tell people that you're in pain. You can't swallow any water. I think anybody would get frustrated. Very soon we'll take the tracheostomy out. Very soon.
The healing process is taking longer than expected. But with a massive tumour removed, the medical team are starting to see how Erick will look when the reconstruction is complete. The only person not to have seen the progress is Erick, but that's about to change. "17-year-old Erick is recovering from an operation to remove a life-threatening tumour and rebuild his face.
Hi, Erica. How are you?
I'm fine.
You look really good.
But complications during surgery mean that the plan to do all the work in 24 hours had to be abandoned.
You're very brave.
Now he faces yet more major reconstructive surgery. But before that, he's making the most of his newfound freedom.
Erick had this tumour since he was 3 years old. To suddenly feel the weight loss, the knowledge that he could breathe properly, it's a very, very big moment.
Now he's about to meet the new Erick for the very first time.
I think it's impossible to sort of emphasise, what a significant change it would have been for him just to feel that he didn't have this massive tumour on the side of his head.
I asked him about the person whom he's seeing right now, and he told me he's not seeing the Erick that he was before. He's seeing his role model. He calls himself Bebeko. He's a music artist in Uganda. Orasoka nativana kulongoza waitwena suvi ni wamala suvi nilikomao nolowida dalanga ogenda tukiriza buchinga chimwe nyecho tsaza mama kati kutosa kati oliloti
Hawantu kagala ogela.
mani gengela ngena chirongini.
I think sort of 3 or 4 weeks after his surgery, as he was starting to recover, his character started to emerge. We had a few episodes where there were little footballs kicked into other people's beds and things like that, because he's a teenager and that's what teenagers do.
Yeah.
Well, although he's a small man in physical height, he's a huge man in stature because he's got such a great personality.
Okay. Hola. Ready? Oh, that was too hard for me. I can't do it.
From the very first time when I met him, he was, for sure, I had no hope that he would be this person that he is right now.
Brian has been with Erick since he arrived in the UK. He is Erick's only link with life back in Uganda.
Go down.
It was a tough situation, there was no hope, and he had almost given up on everything. I don't think he had ever been happy like the way how he is right now.
Yeah, amazing to see what he actually looks like, and you can tell it's made so much of a difference to him. He's got his personality back, he's bubbly, he's friendly, he's, running around, trying to join in, was sitting behind the nurse's station with us this morning. Yeah, one of the family.
He's a very strong personality and he's got a great sense of humour. He's very funny. He knows how to sort of tell a lot of jokes and get his sort of witticisms across, you know, to nursing staff and doctors. You have to come up here. This is... there he goes.
Oh, Sanchez.
And today, Erick is making the most of his newfound confidence by leaving the hospital for the first time.
When I first met him, he used not to associate with many people during daytime because of how he was looking. He was more of moving out during nighttime, whereby people couldn't easily notice him and stare at him.
But Erick still has more grueling surgery ahead of him.
Go to the
Erick's last operation was aborted when his blood pressure dropped dangerously low. So for this reconstruction to succeed, all traces of the tumour must be gone. Then they can again attempt to give him back his face.
Are you okay? You all right?
Okay.
Okay? Yeah.
How long will it take?
That's a very good question. Possibly, yeah, about 6 hours, about half the length of time the last big operation took. So it's not as big as the first operation. We'll see you later. See you later. I'm hoping after this, as is Erick, that this is his last procedure.
The difficulty for Erick is what's been removed needs to be replaced in some way or other. And essentially, there's nothing in the central part of his face below his eyeball. There's a hole between the side of the nose and the brain. There is no half nose. There is no palate for him to chew against or speak against. And his lips are all over the place, and he needs to have lips that he can then close so that he can speak and eat properly. And we have to make sure that anything he puts in his mouth doesn't go up into the brain cavity. So everything's about sealing off cavities, trying to keep enough bulk and shape to hold the skin in a good position. And that means you've got to then import tissue from other parts of his body in order to do that.
The tumour has completely shattered the lower part of Erick's skull. The plan is to use muscle tissue from Erick's leg to reconstruct his cheek and palate, and use skull bone to reconstruct his jaw and nose.
Just mark the corner of the mouth where he's re-established a corner. Previously, we had to cut that out because there was so much redundant tissue. And the corner of the mouth is actually quite specialised. But the ring of muscle around the mouth, he's learnt to use to make a new corner of the mouth really quite well. And we want to make sure we keep that well established.
First, they cut along Erick's old incisions to open up his face, and then begin the second reconstruction.
Skin hook, please, Nora. I want to not displace his nose there if we can do, because actually we've plated it down, it's going to be more difficult to get it back, so it'd be quite nice to...
It'd be nice if we get it down.
So about an hour into the surgery, we're feeling, we're feeling very, very optimistic. But actually, as we began to open the tissues up, we were confronted by this mass of white tissue.
There's like tumour underneath it. Was that a bit we flipped?
We're preparing and having a look inside Erick's mouth. What we found is quite a lot of tissue which looks very like the original tumour.
With the procedure only just started, the surgical team worry that their worst fears are realised.
And obviously what we're going to do is a complex reconstruction and find out that we've left lots of tumour behind. So these things weren't evident from the outside, but...
Could we call that base of right alar? Yeah.
So we're just going around and taking quite a lot of samples at the moment. Can we send that off for specimen, but orbital floor?
It's critical they know if Erick's tumour has already started to grow back.
See, interesting, that just looks like a star now there.
I think that blob we took out looked more worrying, though.
Can we send this biopsy as...
Almost temporalis.
Right into the temporal.
For the second time, the team are forced to abandon the rebuild of Erick's face. All they can do now is wait for the results.
I think we're all very devastated at that point. It was a palpable air in theatre. Things changed quite a bit.
If the tumour had come back so quickly after his first surgery, it would have meant it was a biologically very bad tumour, and then our chances of saving his life, again, hugely at risk. So yeah, you know, it's a really bottom of your heart feeling.
To have taken somebody who has put their trust in you to make them better, to then sort of saddle them with another sentence that, yes, we've got rid of the swelling, but actually the tumour is going to come back and ultimately kill you, was very daunting and very upsetting.
Now Simon and Niall have to break the news to Brian.
Hi, Brian. How are you? Well, we've actually finished Erick's operation. Erick's absolutely fine, but actually there may be some more tumour there. When we went inside and had a look inside his mouth, there were some things that looked very much like the original tumour. And so we've taken some more samples and taken that tissue away to get it checked out, because we don't want to do the reconstruction if there's tumour there, because it will come back very, very quickly. It's going to delay things somewhat, but if it's just scar tissue, then we go ahead and do the reconstruction. But if it's more tumour, then we may need to take some more tissue away to make sure, try and reduce the chance of it coming back.
Brian's been a real brick throughout the whole process, and we've learned that we can rely on Brian and that he's been a fantastic support for Erick.
It's hard, isn't it? It's okay. Brian felt, I think quite rightly, that it's in Erick's best interest to not explain the complexity of what we thought was there.
Brian has more than the possibility of the tumour returning to keep from Erick. There is now another, even more worrying possibility. The tissue is cancerous and it might return and kill him.
I kept that from him. I never explained everything about cancer to him because he was in a situation which was hard, and that would really break him.
With the reconstruction halted, Erick comes round in recovery, only to learn that he has no option but to endure yet more surgery.
He doesn't know really about what cancer is, so I never went much into details of cancer till when we were to receive the final results.
His left hand? Okay. Get a bit of tissue. Just water? Ordinary water? Just get him some water.
I don't think he would stand any other surgery after knowing that it could be cancer.
You're just waking up.
Now Erick's life depends on the biopsy results. It's an agonizing wait. 17-year-old Erick has undergone major surgery to remove a gigantic tumor from his face. But there is another potential obstacle to his recovery. On the second attempt to rebuild it, surgeons have found tissue that could indicate the tumor has regrown after only a few days. While they all wait for the test results, Simon Eccles visits Erick every morning.
Which bit hurts? Where is it sore? Can you show me? Yeah. Erick went into his second operation, the reconstructive operation, thinking this is going to be very straightforward. We had to speak to him to say there was a chance that there was more tumour there. Of course, the implications of that were that this wasn't just a tumour, this is a malignant tumour. And of course, if it was a malignant tumour and it had recurred, then the chances are that that would then kill him. See you then. Bye. Bye. Thank you. So, he knew that something was wrong. He you could tell he felt that something wasn't quite right. He lost his balance for a few days.
Erick's biopsy tests have taken nearly 2 weeks, but now Simon has news.
Me again. How are you? All the other specimens and biopsies that we took, there was no more tumour in there at all. It's just scar tissue, which is very good. Why don't you tell him? Which is really good. Hey. Nice big smile. Yes, that's absolutely right. Yes, and that means today we can do the last big surgery, and this will be the proper reconstruction. You're very welcome. See you in a bit. Okay.
As before, Simon will be leading this reconstruction.
Very good. You?
Okay, so we're doing a full chat.
Yeah.
It's a 2-phase operation. First, the team will use a piece of Erick's skull bone to replace the jaw and nose that was destroyed.
Can I have a stool, please?
Then they will cut out a flap of muscle tissue from his leg and use it to replace his palate and cheek.
Did you shave Erica's hair?
Yeah.
Poor man.
He liked it.
Did he?
Wanted it, yeah.
While Simon is harvesting a piece of skull bone to use for Erick's jaw and nose, fellow surgeon Zhu Ling is isolating the tissue to be transplanted into his face.
We took a flap of skin and tissue from his leg, and that was to create an artificial palate, almost like an artificial top jaw, to separate his mouth below from his eyes and his brain above.
Okay, I think we're about ready here.
It's taken 7 hours for Zhu Ling to extract the muscle tissue that will go into Erick's face.
So we've done the bony bit of the reconstruction. We're going to take Zhu Ling's flap off now, plumb it in. Nice vein, that's good actually, isn't it? It's perfect.
Because the flap is living tissue, in order for it to stay alive, it needs a blood supply, which means attaching it to the vessels in Erick's neck.
There's lots of stages. One, you've got to make sure you've got vessels there in the first place. Secondly, you've got to make sure that when you transfer the flap, you do that carefully. Thirdly, that when you join the blood vessels together, that the blood flows into the flap and also flows out again. The whole process can be difficult. It can be very difficult.
They put the flap in place, then graft it to the blood vessels in Erick's neck. Now the most important part, to wait.
If the patient leaves the operating room and the table and then the flap is not successful, it's never going to be successful. So it's worth spending the extra time making sure everything's going to be fine.
So far, the signs are not good.
I don't know why that would have flowed before, but just stopped there.
I just don't think it's getting into the flap, do you?
No, it's not. It's so annoying.
A kink in one of Erick's veins is stopping the blood flowing to the flap. They must straighten it out and try again.
I think I'll need the microscope. Yeah, let's get the microscope. Yeah. Bring it. I hope this works. I just want to get this fixed now.
I agree. Pub's going to close if we're not careful.
No. Oops. Hang on.
Just hold on to the end and just pull this one through.
Yeah, good. Thank you. Just cut this tail.
No, that's good, Jew. That's very good. Look at that. But look at these veins. This old blood's flowing into them already.
Just bounding like crazy now.
It is. I think probably should have about a 10-minute break or something and then come back and have a look. If it's okay, then actually, I think we'll finish.
The medical team use a Doppler machine, a device that uses sound waves to detect blood flow, to confirm that the graft has definitely been a success.
Literally, it's just about 7 o'clock. Yeah.
Good.
Great.
Erick will never look like he would have if he hadn't had a tumour, but the surgeons are now satisfied that with time, he will adapt to his new face.
I'm relieved that we've got so far down the line and Erick has got no sign of tumour recurrences. He can go on and have a normal life.
Gone is the little boy hiding in the shadows. In his place is a young man, ready to make his mark in the world.
He now has choices in life and he'll have to start making them. And now he has to start growing into a man.
With his surgical journey at an end, it's time at last to embark on another, the journey home.
We've achieved what we set out as a team to do, to give him a face, and that face is what he can show to the world.
It was extremely lucky for Erick that Brian found him. And the tragedy is that there are so many other children in the world who don't get a Brian to find them.
After 9 months of separation, father and son are finally reunited. Erick has endured multiple, complex operations to free him from the massive tumour. He now has a new face and a future. The world he once shunned is now his playground.
I was so happy to be here.